Hello, AP staff students. So today we are reviewing Chapter 13, Part 1 on experiments and observational studies. An observational study is when researchers do not assign choices. Instead, they simply observe them. Or in other words, the researchers do not manipulate any of the factors that are being employed. For example, for his statistics class, researcher Jay Gilbert decided to study how parents' income affects children's performance on standardized tests like the SAT. He proposed to collect information from a random sample of test takers and examine the relationship between parental income and the SAT score. So, since the researcher obviously did not assign the students to the parents with a certain category of income, because that would be immoral, this is obviously an observational study because he did not manipulate any of the factors. So, after you have identified that it is for sure an observational study, then you have to decide whether it is a retrospective study or a prospective study. So the difference between those two is that a retrospective study is an observational study in which subjects are selected and then their previous conditions or behaviors are determined. And a prospective study which is an observational study in which subjects are followed to observe future outcomes. So in other words, retrospective study observes past information and prospective studies observe current information. So in the previous example, that was a retrospective study because Gilbert identified his students and then referred back to the previous parental income and SAT scores. If he wanted to turn that into a prospective study, he would have had to figured out his subjects beforehand and then followed their current SAT and current parental income. So observational studies are valuable for discovering trends and possible relationships. But remember, observational studies do not equal causation. Okay, so on to randomized comparative experiments. An experiment is a study design that allows us to prove a cause and effect relationship. The experimenter must identify at least one explanatory variable called a factor to manipulate and at least one response variable to measure. So in a perfect experiment, this is what would happen. So the researcher or experimenter manipulates factor levels to create treatments. Then he randomly assigns subjects to treatment levels. And then he compares the responses of the subject groups across treatment levels. So in an experiment, the experimenter actively and deliberately manipulates the factors to control the details of the possible treatments and assigns the subjects to those treatments at random. The experimenter then observes the response variable and compares responses for different groups of subjects who have been treated differently. So humans who are experimented are called subjects or participants. And then any other individuals, whether it be animals or plants, etc., are called experimental units. And the specific values that the experimenter chooses for a factor are called the levels of the factor. And then a treatment is a combination of specific levels for all the factors that an experimental unit receives. So the difference between an observational study and an experiment is that in an experiment, the experimenter is manipulating the factors. He's manipulating which level of the factor you're getting, and that determines the subject's treatment. Okay, so on to experiments and samples. So both experiments and sample surveys use randomization to get unbiased data, but they do so in different ways and for different purposes. So sample surveys try to estimate population parameters, so the sample needs to be as representative of the population as possible. And experiments try to assess the effects of treatments, and experimental units are not always drawn randomly from the population. With this, just make sure to watch your wording when discussing experiments. Make sure you are clear that randomization occurred when assigning subjects to treatments, not when choosing subjects to treatments in the experiment. So just make sure you watch that wording a little bit when you're explaining your experiment. So on to control treatments. Often we want to compare a situation involving a specific treatment to the status quo of the situation. So in a control treatment and a control group allows us to do that. So it is a baseline measurement is called a control treatment, and the experimental groups to whom it is applied is called the control group. So usually a good example of a control group would be receiving a placebo treatment, and I'll talk more about what a placebo is later in this video. But then if we use them as the control group, their responses provide a basis for comparison. So when we know what treatment was assigned, it's difficult not to let that knowledge influence our assessment of the response, even when we try to be careful. So in order to avoid this bias that might result from knowing the treatment was assigned to which subject, we use something called blinding. And there are two main classes of individuals who can affect the outcome of the experiment. So A being those who influence the results, so that would be who you're testing, so the subjects or the technicians and then the second one would be those who evaluate the results, so the experimenter or the judges or the treating physicians, anybody who is evaluating the results. So when individuals in only one class are blinded, this is called single blinded. So either the subjects are blinded or the experimenters are blinded, only one of those, that is called a single blind. Compared to when everyone, so in both cases they are blinded, the experiment is called a double blind. So it's pretty self-explanatory. If one class is being blinded, then it's single blind. If both classes, so nobody knows what the treatment is, it's just random, then it is called a double blind. So often simply applying any treatment can induce an improvement. So to separate out the effects of the treatment of interest, we can use a controlled treatment that mimics the treatment itself, which is where placebos come in. So a placebo is a fake treatment that looks just like the treatment being tested. And placebos are really the best way to blind subjects from knowing whether they are receiving the treatment or not. However, the downside of this is something called the placebo effect, and that's when a patient or a subject is given a placebo and they believe it has an effect them in the same way that the actual treatment has. So, for example, the placebo would be a sugar pill compared to maybe a new sleeping pill that they're trying to experiment on, and this new sleeping pill is going to help you sleep longer. Well, the patients receiving a placebo, if they come back and say, oh yeah, I slept so much better, that would be called the placebo effect because they believe that the treatment has affected them in some way. And let me tell you, the mind is a powerful thing. So this really highlights both the importance of effective blinding and the importance of comparing treatments with a control. So placebo controls are so effective that you should use them as an essential tool for blinding whenever possible. Okay, so diagrams of experiments, our last slide, yay! So it's often helpful to create a diagram of the procedure of an experiment. So the following diagram below emphasizes the random allocation of the subjects to the treatment groups, the separate treatments applied to these groups, and the ultimate comparison of the results. So down below is a great example of what a perfect experiment would look like if you were to draw it out. And really, this just personally, as an AP Stat student, it really just helps you keep everything organized and it's easier to compare in the end. So thank you for watching, and I hope you score a 5 on your exam.